Doctor, healthy life requires a lot of walking, maybe gymming, doing a little bit of pranayam. These are all breathing related activities. So if somebody is suffering from asthma, would you suggest that they go for it, or you suggest that you do not go for it? What is your...
No. So for an asthmatic, he must live a normal life. We've done a study long time back where we looked at yoga and breathing exercises in asthmatics and showed that asthma control was better in those individuals who did regular exercises and yoga.
Right.
And therefore, for us, in a person who is an asthmatic, doing exercises is a good thing, both breathing exercises and upper and lower limb exercises. It improves his cardiopulmonary reserve, it opens up the lungs, and therefore gives a better feeling of well-being and also helps in asthma control. It's not a cure for asthma, but it definitely helps in decreasing your medication requirement and giving you an overall feeling of well-being.
Doctor, we'll get into a little bit of understanding sleep apnea for our viewers. But before that, discussing on asthma, does it have a direct linkage on the pattern of sleep or the quality of sleep?
So the issue is what we call comorbidities with asthma. So there are certain diseases or certain links which asthma has which can lead to worsening of asthma, and unless you treat them all, asthma control will not be good.
Okay.
So those include upper airway problems. So if a person has allergic rhinitis, for example, if he's sneezing a lot, there is running nose, then these persons will also have a post-nasal drip.
Okay.
That is, secretion from the nose, the back of the nose will go into the throat and the chest, and if the person is having asthma, the asthma will become worse.
Okay.
So unless you treat the upper airways, you won't be able to get the lower airway or the asthmatic treatment.
Okay.
Similarly, asthmatics also get worse if there is acidity or what we call gastroesophageal reflux.
Right.
If an asthmatic has a lot of acid related problems and reflux, if he's coughing or breathing or lying down and the acidity comes from the stomach up to the throat, that may go into the chest, and that will lead to worsening of asthma.
Right.
Similarly, if there are sleep related disorders, then during sleep also there will be a worsening of asthma, which will lead to problems when it comes to asthma control. Obesity is another thing. So obese individuals who have asthma have poorer control of asthma, because not only does the weight or the overweight lead to lesser ability of the lung to expand, but it also leads to more inflammation in the lung, which occurs because of the adipose tissue increase which obese people have.
Right. Doctor, now touching on sleep apnea, what is it, and what are the ways we can identify this and come to a professional for help?
So obstructive sleep apnea or sleep apnea is a disease which is actually grossly underdiagnosed. We are having this major problem that large number of people are having this problem and they are not diagnosed because there is lack of awareness.
Right.
What happens in sleep apnea is that it occurs mainly in people who are overweight, and they tend to snore a lot. So when you are sleeping, the muscles of your upper airways relax as part of sleeping. If you have airways which are small, then while you're sleeping you start snoring. Your snoring becomes louder and louder because the airways start becoming closer and closer, and at a given point in time they will collapse.
Okay.
That is, both the walls will come together and you will not have any air going into your lungs.
Right.
So it's almost like you're choking.
Yeah.
Once this happens, then the oxygen in the blood starts becoming less because no air is going into the lungs. There's a decrease in oxygenation. There's a fall in oxygenation.
Right.
This then goes to the brain and stimulates the brain. The brain then stimulates the lungs, and there's a little bit of wakefulness, and you have disturbed sleep.
Right.
You wake up, the airways open, you gasp and you start breathing, and then after a few seconds or minutes, the cycle is repeated. Again you start snoring,
Right.
and your snoring gets louder, and so there are people who have this more than 100 times in an hour.
Oh, wow.
And if you have it more than 30 times in an hour, it's a severe obstructive sleep apnea.
Right.
So what happens is this causes what we call fragmented sleep. The person feels he's slept throughout, but the depth of sleep has become less because his sleep is being disturbed every few minutes or seconds because the airways are collapsing.
Right.
Therefore, he gets up not feeling well. he has a feeling of early morning headache, and this daytime somnolence. So person will tend to fall off to sleep during the day. So while he's doing something monotonous like driving a car on a highway, he'll go off to sleep. And that is why abroad you will not get a license if there is a suspicion that you have obstructive sleep apnea. Because there are a large number of accidents which have occurred because people have had this disease and go off to sleep while driving. While watching television, you will tend to sleep. While doing anything monotonous, these people will doze off because they don't get good quality sleep. But more importantly, this disorder is now linked to a lot of other illnesses, to what we call metabolic syndrome. Because when your oxygen keeps falling repeatedly during night, it causes a lot of strain on the heart and on the whole body. So there is now a very strong association with obstructive sleep apnea and heart disease, strokes, diabetes and various other disorders. So there is a strong link.
What you mentioned is that comorbidity aspect of any disease needs to be. So if somebody comes to you with a particular disease, a good doctor would check all the.
So if you have a person who is say a hypertensive and is obese, who is a diabetic, who is obese, who has a history that he feels tired during the day, tends to doze off during monotonous activity, or the spouse or the partner says that he does snore a lot at night, you must evaluate him for obstructive sleep apnea. Most patients come when they are have had an advance, they have really progressed to the stage when they are actually have a very severe problem. So a lot of these moderate patients get missed till it's caused a significant degree of strain on the body.
Doctor, thank you for your time, but before I sign off from this interesting interaction with you, I would request you to put in a word of advice to our viewers, especially on World Asthma Day.
So I think the very important thing for viewers to understand is that asthma is a disease which can easily be controlled if treated properly, and therefore one should not shy away from a diagnosis of asthma. If you are able to understand the management of asthma, it can easily be treated and beaten. Second issue is that inhalation therapy, inhalers, are the current main focus or mainstay of treatment as far as asthma is concerned, and therefore they should follow the doctor's advice and take the inhalers regularly. Even if they are alright, sometimes they have to take it as preventive strategy for a longer period of time, and therefore not feel shy of using an inhaler, because that will actually lead to a better control of asthma. And an asthmatic should live a normal healthy life and do all outdoor activities that he or she wants to do.
Doctor, thank you for your time. We really appreciate your time, and on behalf of my viewers, I really appreciate the time you gave to us.
Thank you very
so
much.
much.
Thank you.